And hello, hi, it's Kathy Frey here from IMCO, from the International Integrative Maternity Healthcare Organisation. And a big welcome along today to Dr. Jessica Drummond. Say hello, Jessica.
Hi, I'm so glad to be here. Thanks so much for inviting me, Kathy. It's my pleasure to be here today.
Oh, and it is neat to have you here because you've got such an interesting topic that we're going to be talking about today. And the format today is really just a general chit chat where Jessica will be doing most of the talking. But just to go over the topic that we're talking about today, and that is postpartum nourishment. So basically, how to add nourishment, into that postpartum diet for the mum, because that's just going to build immunity, health for both the mother and the infant. It's funny because so often when women are pregnant, they are very aware of that nutrition that's coming in and what needs to be done for growing this baby. But somehow once that baby's born, and we are exclusively breastfeeding, we forget it's that baby's still getting all that nutrition from us. Yeah, and in fact, they need more because they're getting bigger and bigger and bigger. So look, in this presentation today, you're going to learn a little bit more about which nutrient deficiencies are the most common in postpartum. Fascinating. And plus you'll learn how functional nutrition testing can assess individual nutrient deficiencies and stresses to the immune system, the digestive system, the nervous system, etc. And Jessica's also going to be talking about valuable nutrition tools that can be used to heal birth injuries, including episiotomies, perineal tears, and to support C-section recovery, which is always major abdominal surgery. That always seems to get a little forgotten along the way because it becomes so commonplace, but it's major surgery. And finally, we're going to be assessing nutrition and lifestyle strategies in the conversation today to support improving postpartum sleep quality. So look, I'm going to hand you over soon to Jessica, let her do an introduction for you today about her. She is, to give you a little overview, she is the founder and CEO of the Integrative Women's Health Institute and the Outsmart Endometriosis Health Coaching Program, and the creator of the Women's Health Coach certification. And her passion is caring for empowering women and people in general who struggle with pelvic health concerns. But let me hand over to you, Jessica, so that you can give a little bit more overview about your background and your specialization in this topic. And then we'll get going talking about it. And of course, those watching here today, if you've got any questions or queries, just type them into the Q&A button, which is at the bottom. So yeah, Jessica, please tell us more.
Yes, thanks so much for that lovely introduction. So I come to the field of women's health through a clinical background and a health coaching background. So I started my career back in 1999 as a physical therapist, or I think physiotherapist in New Zealand. And I worked initially in sports medicine and have worked with many female athletes. But pretty quickly, I began to specialize my practice into women's and pelvic health, which in the world of physical therapy is a lot about recovery postpartum. It's a lot about like pelvic and back pain and rib pain and things like that related to pregnancy, but also things like incontinence and pelvic pain, sexual pain. And a lot of that overlaps because in postpartum, we also are in a low estrogen situation, which can impact postpartum sexual health. There's rib pain related to breastfeeding positioning, and there's all kinds of fatigue issues. So I worked in for many years at the Women's Hospital of Texas in Houston, Texas, where we delivered approximately one baby every minute, 24/7. So we saw all kinds of really busy stuff. I did manual therapy in the labor and delivery room, and we saw many women on long-term bed rest and high-risk pregnancy, multiple pregnancies. And then I had my first daughter in the midst of that, and she's about to turn 19. So it's been a while, just dropped her off at college. And I then was sick postpartum in the sense that I struggled with a pretty severe chronic fatigue issue, which I now think was related to a post-viral syndrome related to Epstein-Barr virus. And I'm sure you're probably seeing a lot of post-viral long COVID now. I do see a lot of that in my practice. We have maybe a lot more COVID than you do there, but the post-viral fatigue started me down that, and that was activated by my postpartum experience, started me down the path of learning more about functional nutrition and nutrition in general. And I eventually got a doctorate in clinical nutrition back in 2017. And in the meantime, I developed both the skill set of health coaching and now have taught it to several thousand people, including practitioners in 60 countries, actually a little more than 60 countries around the world. So, and that skill set is about really listening. What's the skill set of listening to your patients and clients and helping them to actually implement the recommendations that you've made. Because one thing that we learn a lot in our clinical trainings, whether it's physical therapy or nutrition or medicine or nursing, is the list of recommendations to give people, and we hand them that, but we don't often take some time after that to really talk to them about how can they implement, which are the priorities, and especially when we're talking about postpartum women, there's so much on their plates, as one of my old bosses back in Texas used to say, as you mentioned, C-section is the only major abdominal surgery where you get no rehab, and they also give you an infant to take care of.
I know, it's just nuts, isn't it? And we often sort of compare that labor as the calorie equivalent of doing a marathon. So often, before women end up having a C-section, they've just done the calorie equivalent of a marathon. So they've gone straight from a marathon to major abdominal surgery to be handing a baby and saying, hey, feed that every 2 to 3 hours. It is insane what we put women through at that point, which has become a normalized situation, and it's anything from normal, isn't it?
Right.
It is very crazy. What do you find are the most common health issues that postpartum women face that can be improved with a bit of extra or better nutrition? I think that one of the things that we can battle with a little bit, especially I can sort of say it from my perspective as a midwife, is that we can be talking with women about their needs and babies' needs in the postpartum, but often when they're still pregnant, it's just so far from kind of quite where they're at. And it's not really being absorbed that well. There's a lot of focus of like, if I can just get past the birth, then everything will be fine.
Right.
That's where the can of worms really opens up. And then of course, in that postpartum, they are so in recovery. They're so kind of in that almost emotional shock of, oh my God, I've become a mother and I've got all these things to do, and there's this baby and there's all the visitors. Like the whole thing is so full, and it's hard to find that space in their brain almost to think about what they're eating. Yet at the end of the day, that's their petrol tank, isn't it? You know, so,
Yeah.
and that's their baby's petrol tank. So it is really tricky. But getting back to what are the commonest sort of health issues that you are seeing that can be improved with nutrition? I guess one of the top ones would be healing recovery.
Yeah.
Mm.
So, as you said, it's hard to talk about this with first-time pregnant moms. So what we often do is have this this plan about how you're going to feed yourself after, what's going to be in the freezer, who's going to make you food. A lot of times, at least in the US, because we don't really get any maternity care, you'll often just ask your friends or time off, there'll be kind of like a meal delivery sort of train set up, right?
Yeah.
Among people's friends. And so we'll say, people can just bring you anything. That's always helpful because then someone in the family can eat it. But it's even better if you ask them for very specific things that are easy. It could be soups, it could be casseroles, things that are make ahead and can be stored. And as you said, women prenatal with their first baby don't have any understanding of what it's going to be like after. And so just getting a few meals in the fridge and focusing on hydration immediately postpartum and things that are fast to eat, like smoothies and soups, things that are very easily absorbed, is kind of step one for that transition. Then where I'm often more successful and where, our practice is often more successful is working with women who are preparing for their second or third birth or beyond, because then they know everything, or at least whatever their experience.
Difference, isn't it? Because now they're like, okay, I am not making those mistakes that happened last time. And right from, the taking control of their pregnancy, they are not going to be railroaded through the system with their birth, and they hold the reins, not so tight that it's that they're got a control issue on it. It's more like, I am not going to allow me to be kind of pushed in all directions, and yeah, it is a lot easier.
Yeah. And I think we can keep talking about this in the first pregnancy. And then where I think the intervention can happen first pregnancy is, as much as possible, you just sort of prep the freezer and prep just tell them that they're going to need a support network, because a lot of women don't even realize that. Thinking about, boundaries around how many visitors and who gets to visit and when they get to visit, what's that first couple weeks little cocoon going to look like, who's going to be feeding you, all of that. And then when we can then intervene, like a couple different places early postpartum after a first pregnancy or any pregnancy, is if a woman has a postpartum doula. So after I was so sick with my first daughter postpartum, and I barely even noticed it because I was so busy taking care of her and trying to get her to sleep, until, weeks or even months later, it was about 3 months later that I thought, woo, I am super sick, and but the second baby, I hired a night nurse which was like a postpartum doula, only for a few weeks. And it was probably the best money I've ever spent on anything in my entire life. Right.
Wow.
So in your profession, in midwifery, in doula, in postpartum doula, in night nurse, and even just any support system, there's where we can start in the prenatal timeframe or early postpartum, delegating that nourishment piece, because really there's only two key things that people need for nourishment immediately postpartum. That sleep, which is very difficult because you've been handed that person who doesn't sleep at all, or sleeps a lot but in very small bursts. And an adequate calories, nutrients, and hydration, and a little bit of sunlight if you can get it. And then, so hydration is step one. We can really educate on making sure your urine is clear, making sure you're getting about, so if someone is, 120 pounds, half that body weight in ounces, so about 60 ounces of water, a little bit more. You can't really overdo it. And we add it with, you can overdo water, but it's very difficult to, people don't tend to do that. So, and then adding in some electrolytes can help that water be more readily absorbed. And there are so many good electrolyte products out there that are not high in sugar, have a wide range of minerals, and it just really helps the water to be well absorbed. It doesn't have to be in every bottle of water, but 1 or 2 a day, and then you're kind of keep filling your water bottle and count how many times you'll drink that, depending on how big it is. And then the second thing,
understanding that there are sports rehydration drinks.
Yeah.
There are energy drinks, right? And people often get the two of them confused. But if it says it's a sports rehydration drink, then that's when there will be electrolytes in there, isn't it? Yeah. And
right. We don't really want energy drinks, because usually that has a lot of caffeine.
Don't want energy drinks. No, because that can have caffeine in it. You don't want that going through the baby. They'll really
no.
So it is, look, so people do get those two confused, but of course you can get really good rehydration sachets with electrolytes from the pharmacy, chemist, drugstore. So, and that's the same thing that women should be using, of course, in that first trimester when they are, doing, when there's vomiting going on quite a bit, we just want that rehydration with the electrolytes in it. And man, I have seen women absolutely just have an incredibly rapid perk up when they stop drinking water, and they'll go and have a rehydration drink, and you can see within half an hour, 40 minutes, they're just like, they just feel better again, right?
Yeah. And if they can't even get something like that, the simplest thing you can do is just use a little bit of sea salt. Because sea salt also adds all those minerals, just like maybe a half teaspoon, quarter teaspoon even, for every glass of water. That helps absorption, which is a little counterintuitive, right? To be drinking salt water, but it's actually very helpful. And then the second piece is calories. So if someone is very fatigued, hydration is the first step. That's one of the most important, most common things we see postpartum. Second is calories, which we need for building milk supply, but also just for the mitochondrial healing, sort of energy healing at a cellular level. We have to have just enough energy. And that's one of the bigger problems. Women tend to not actually get enough calories postpartum, because you actually need more calories if you're nursing than when you were pregnant. So when women are pregnant, they're thinking, eat for 2, but they actually need more calories postpartum. Now,
and the trick is often forgotten. And it's like, the baby's born now and I'm breastfeeding, so now I don't have to think about, no, your baby's getting bigger and bigger and bigger and bigger. So your calorie output and even just the amount of milk that you're producing, quite often a brand new baby will a whole 24 hours of feeding may only be 30 mils, 2 tablespoons. But by the time that they're a month old, they're drinking a liter a day, or 4 cups. But it's
a significant change.
And your calorie needs have gone up to produce a liter a day of milk versus growing the baby inside you.
Right. And this can go on for months to years as women are, nursing toddlers or just, 1-year-olds. I mean, it's a lot to produce. And over that time, you're sometimes getting more and more fatigued if you haven't had adequate support. So calories is one thing, but then nutrients is really key, because this is where we have some power to directly impact healing. So postpartum, it's
And
very
I guess
common
that
to
there
have.
must be a way that you would assess, what those most common nutrient deficiencies are.
Yes.
I would often,
So,
I practice for just as a little, I'm not
mhm,
a
mhm.
nutrient specialist, but, when I would see women whose skin was not healing as quickly as it should, the first thing I would be thinking about would be zinc. Are you still taking your daily multi? And sure enough, that might be something as simple as that can affect it, can't it?
Absolutely. And so actually physical exam is one way we can actually be more skilled at looking for nutrient deficiencies. So if women are lacking like the little half moon at the bottom of their nails, that's a sign of zinc deficiency. If women have like those red bumps on the back of their arms, that's a sign of omega-3 fatty acid deficiency. If their hair is falling out or they have really thinning skin, that could be a few different things, but it's often a protein deficiency and or a thyroid issue. And the thyroid, postpartum, the thyroid is quite vulnerable, and we can protect it by starting to take 200 micrograms of selenium as early as preconception all the way through postpartum. Almost entirely prevents postpartum thyroiditis. So adding in that 200 micrograms of selenium, which is just like 1 or 2 Brazil nuts a day, or you can take it in your prenatal vitamin. Protein deficiency, as I mentioned, the thyroid is also very sensitive to EMFs. So keeping your phone and your computer less than 2 hours a day of time for that close to your body. That's really where the issue is. So we'll, reduce kind of some of the stress on the thyroid. There's some interesting research about that. And as I said, protein is really key because amino acids will help rebuild the collagen for the skin around the skin and fascia and deeper muscle that's affected during a C-section, during an episiotomy, during a perineal tear. And we could use supplements like collagen protein supplements or like paleo protein supplements. But also, if a person's just eating well, they're chewing well, they might need to take some digestive enzymes to make sure they're really absorbing. They're not on a lot of drugs that suppress their acid, which sometimes women are because they have heartburn during the pregnancy and maybe they're still on these acid reducing medications. Then we need adequate pH in the stomach to appropriately digest protein and get to the level of amino acids that can help rebuild those soft tissue injuries. So eating enough protein is important, but being able to digest it is key. So one of the, beyond physical exam, we use testing in our clinic called urinary organic acids testing, which gives us kind of a general picture of what's going on with the digestive microbiome. Are there any overgrowths of not beneficial bacteria or yeast or things like that? But also, how strained are the mitochondria, which is like your cellular energy powerhouse and is really dependent on B vitamins, particularly certain forms of niacin or B3. Nicotinamide riboside is one of them. You need all of the B vitamins really, and CoQ10. So if someone's lacking energy, we can assess their mitochondrial function through that test. We can also look for things like low B12. We can look at that through methylmalonic acid, low or high B6. Any of the B vitamins are really important for structurally rebuilding everything. And so the most common things that we see postpartum are significant fatigue, soft tissue injuries just related to the birth itself, and sometimes even more extensive injuries. There was an interesting study done, I think it was published, it was a while ago now, sometime maybe around 2017, where they actually found that some of the avulsion muscle injuries and hip injuries were really as bad as some pretty serious orthopedic sports injuries. So, having a birth, whether it's a vaginal delivery or a C-section, does need some assessment for things like, if we look at all the muscles in the perineal area, there can actually be an avulsion where this pubococcygeus muscle pulls away from the bone, and you lose pelvic floor stability, you lose continence, it's pretty significant. And those kinds of things need to be dealt with. The other common thing is like a separation of the pubic symphysis bones. It can be very difficult to even walk after that. So we need some stability at the pelvis. We need to look at the hips, depending on the position of delivery. Sometimes there's injuries to the hip joint. And so nutrient wise, we really want to be adding protein and the vitamin cofactors and mineral cofactors like zinc, as you mentioned, to allow those areas to heal. But we need a lot of that because the baby is also taking tons of nutrients and may have taken some of it during pregnancy, because if a woman is magnesium deficient or potassium deficient or calcium deficient, for example, during pregnancy, there can be a transient osteoporosis where the baby actually takes those nutrients from the bones and, it then has to be rebuilt. So minerals are so important. Amino acids, either from protein or from amino acid type supplementation, and then hydration, and then the vitamins that help those enzymatic reactions move forward, especially when we're talking about energy production in the mitochondria. We need lots of different forms of B vitamins in particular.
Right. There's, I guess there must be sort of some tests that you can do, that you can help sort of guide what those requirements are around digestive, immune, nervous system, health, etc. Very interesting, your little array of physical signs and symptoms mentioned before. That's a great little list, but I guess there must be other ways that you personalize nutrient recommendations in that postpartum. And funny you comment about the osteoporosis. I do recall after having my second baby, and I was sitting at the dentist with this little baby in the baby car seat pod.
Right.
And at the dentist, and the dentist is like, you need this. I'm like, oh my God, why? Like, how come I need all this wig? And he just looked at the baby and goes,
Right. Yeah. And, I've seen that many times, particularly in people who are vegan and vegetarian. Now, it's not to say that it's impossible to be vegan and vegetarian while you're pregnant. You can do that well with, adequate attention to protein. But I've seen that actually not only just in mothers, but in breastfed babies who did not get enough protein through, and then the microminerals through the milk.
It's funny you mention that vegan and vegetarian, because I don't have any, robust evidence around this, but it's just my observation is that women who are very lean and health conscious, particularly where I've seen it, is very tall, very lean women who are vegan or vegetarian, and some of the worst tearing I've seen in vegan. And my only and it doesn't make any sense to their age, in that it's almost like their skin is less elastic. That's my best explanation with that perineal. Right. And you're like, oh my God, why? You're healthy, you're young, why could your skin not stretch a little? And yeah, I definitely began to see a pattern that they were women who were very strict on their, not just the vegan vegetarian aspect, but very strict and disciplined on their nutrition in general.
Yeah.
And definitely that would, and I would also see that vegan vegetarian impact on perineal tears with Hindu women as well. Again, because I think it was like, well, you're just not quite getting that same protein fat content, maybe protein and
Well,
fat.
yeah. And I think the other thing that could be happening, particularly in women who are sort of highly disciplined about their exercise, there's a level of stress that comes with that that actually impacts. So, there's a benefit to being very fit. However, what we're learning through like more understanding of things like post-viral syndromes, Epstein-Barr, even long COVID, there's one particular risk factor with long COVID is having low, that Yale University just published a couple of weeks ago, is if you go into COVID having low cortisol. So you're kind of walking around at a level of stress. And I see this in sort of like, just high achieving women in general who have a lot going on. I remember one of my patients years ago, she was working so much and she had really high blood pressure. And finally they were just like, you have got to quit, or, you've got to take some time off for a few months, like for the rest of your pregnancy, or you're going to have a stroke, And so highly disciplined, high achieving, high pressure experiences. And, it could be any baby, because then you often have then the other kids to take care of and Women are often put in really stressful circumstances. And then when they layer on that personality or that achievement, just perspective, there's a lot of pressure on what's called the hypothalamic pituitary adrenal axis. And this is essentially your stress buffering system, which is great. It's ready to be activated, but it's often activated several times a day in people who are living like this, when it's designed to be activated like a few times a year. And when you strain that system such that either you're having high levels of cortisol, which is our stress hormone, or it's just like been either a really intense stress and then the system kind of collapses, or a lot of chronic stress over time. So these women often, they were athletes in high school, they were athletes in college, straight A students, big job, exercising before and after work, or one or the other, other children, aging parents, whatever else they have going on. Just a lot of pressure over, 10, 15, 20 years strains that system, and you end up with relatively low cortisol. And when that happens, that's sort of the foundation of the endocrine system. So already, postpartum is a low estrogen state when someone is breastfeeding. And then you layer on top of that more stress. There can be a very low estrogen state, low testosterone state, even in some cases low progesterone, and you're struggling with like high risk for miscarriage, but also at the level of the pelvic floor and soft tissues here, these tissues have estrogen and testosterone receptors, and without that robust estrogen and testosterone, you end up with the vagina of like an 80-year-old woman, perineum, because you don't have the hormones to nourish this. So when I talk about nourishment, we also need healthy fats to support that system. We need blood sugar stability over time, because that's another thing that can stress that system. So less, if you're eating a lot of sugar or not eating enough on a regular basis to where your blood sugar is relatively stable through the day, not eating enough protein, not eating enough fiber, not eating enough beneficial fats like the fish oils, olive oils, avocado. So it's interesting because, women are taught from such a young age to food restrict, and this is bad, and don't eat so much of this. But really in the perinatal and postpartum period, we have to really think about eating enough just of the right kinds of foods. And it's usually a lot more than people think. Protein can go all the way up to 2 grams per kilogram of body weight. You're literally training for a marathon slash a strength training event at the same time. And then recovering from the endurance of that and the likely, and the potential injuries or just fatigue from that. So you need, like I said, 2 grams, 1 to 2 grams of protein per kilogram of body weight at least. And you also need to be eating quite a bit of beneficial fats to support the production of healthy hormone levels.
Yeah, it's fascinating, isn't it? And but what about if we're talking about that kind of whole microbiome, aspect of the mums and the babes, which is, so topical these days, but I don't feel like people are still feeling equipped that they know the right things to do. We know the word microbiome more, but not necessarily how to, do the right thing for the mum and the bub. What's your thoughts on that?
Yeah. Well, it's important so we can test urinary organic acids to kind of look at an overall picture of nutrient deficiency, of mitochondrial function, is there an imbalance in the good and bad bacteria sort of generally. Then if we want to get more specific, we do some stool testing, and none of these tests are perfect because we don't know what a perfect human microbiome looks like at this point. But what we do know is that there are some, less desirable bacteria that we want to make sure we don't have overgrowing. There are some beneficial bacteria that we want to have in robust numbers, and there needs to be a nice balance. So we can do that through stool testing, literally looking at the stool, and there are a number of different companies that can analyze those in different ways. But it's really important to understand that the maternal microbiome is really foundational to the baby's immune system. And, as we're dealing with this post-COVID world, we're likely, for many different reasons, everything from kind of globalization to climate change, to experience an increase in the number of kind of newer viruses, newer bacteria, newer infections, different kinds of pandemic experiences, because there's just predicted changes in our environment. So our best defense around that, beyond specific treatments, is to just have a really robust immune system. And that starts at birth for moms and babies. And so how do we nourish that microbiome? Well, here's the thing. The quote unquote bad bacteria generally like to eat sugar and processed carbs. Of course, and that's what they make us crave. They literally have a direct communication to our brain that kind of bypasses our conscious awareness. So your brain is talking to your gut microbiome, both through the vagus nerve and through some cytokines all the time. And, it's bidirectionally without you really being consciously aware. So when you're craving things like sugar and, pretzels and chips and pasta and stuff like that, that may be your not great microbiome trying to keep itself alive. What feeds the most beneficial species that really help support us is primarily fiber. So vegetables, whole grains. And so the more we have of that in our terrain, the better it is for those beneficial bacteria to thrive. And there are some foods that really specifically feed certain species. For example, berries, cranberries and pomegranates feed Akkermansia, which is a really strong foundational species. Chickpeas feed Faecalibacterium prausnitzkii, which is another really beneficial kind of foundational species. So, legumes, whole grains, but lots of vegetables, some low glycemic fruits, especially things like berries that are very high in fiber, really, again, need to be a bigger part of the food plan. to feed the beneficial bacteria. And if we don't have, and in addition to that, it's actually beneficial to add some prebiotic and probiotic foods, things like, kimchi and sauerkraut and yogurts, and things like that, so that we're also seeding the good bacteria.
Just fascinating. Absolutely. And but of course, one of the other things that is just massive in that first little period, particularly in that first few weeks, or first couple of weeks, particularly after giving birth, is the healing, isn't it? So whether it's episiotomy healing or perineal tear healing or C-section recovery healing, levator avulsion, as you mentioned, but those, pretty common birth injuries these days. So what's your nourishment strategies around those specifically? Is there anything different to really throw in there in that first sort of 2 or 3 weeks, just so that healing is as rapid as possible?
Yeah, I think the challenge there is more about how to get the nutrition into the mom, right? So it's about really having conversations about what's the support network like, and then having food that's really easy to digest and really easy to eat available. Soups are so good because broths, especially bone broths, but even vegan broths have a lot of minerals, but bone broths also have a lot of glutamine, which is an amino acid, which helps heal the lining of the small intestine, making it even easier to absorb nutrients and not irritate the immune system postpartum, which is key. So broth-based soups are really, really good. So having a lot of that available, fill them with vegetables, add a little olive oil on the top, or a little, avocado, something like that, to add some beneficial fats. The other thing that has a lot of nutrients that we can get kind of a big punch for a small amount is dried or fresh herbs and spices. So other things that help balance the microbiome are things like oregano and rosemary and cinnamon and ginger. So all kinds of soups that really just focus on vegetables, healthy fats, herbs and spices, and proteins go a long way. And then you can combine that with something like a fresh sourdough bread, because that will have the beneficial bacteria in them, for more just calories that is more of a whole grain bread. So, and then pair that with hydration, with some, sports rehydration powders is really good. And I suggest actually that women eat like that 3 times a day. If it's hotter, in the season, then we can do more smoothies or cold soups or something like that. But smoothies, same thing. You can put healthy fats in there. You can put a protein powder. You can put some berries in, and really have kind of a complete meal for when it's just hard to eat because you're like trying to sleep and you're trying to take care of the baby. And, in the US, we have an average of about 6 weeks before we have to go to work full time. So, and for many people, it's 2 weeks. So, imagine juggling all of that and trying to eat. You just have to have things that are readily available.
And those protein powders are that using in smoothies are always such a great idea, and that's really good for women when they're pregnant as well. It's the same thing.
Mm-hmm.
And I'd often say to women, just go into the health section in the supermarket and find that big container of protein powder that's clearly designed for muscle build, a bodybuilder type product. And put scoops of that in your smoothie, and they're like, really? You're like, well, you're building a body. You're building the baby's body, right?
Right, you're literally bodybuilding.
You're literally building a body, whether they're growing inside of you or outside. You're building a body. So give yourself that stuff to be able to pass on to baby.
Yeah. And I think the key to look for in terms of a quality protein powder is you just don't want a lot of stuff in it, like a lot of extra sugar or fillers or things like that. You want it to be pretty much protein. The ones that I use the most are hydrolyzed beef protein, because you'll find that under names like Designs for Health has a paleo protein. That's an option. Collagen proteins are good. They have them made from fish, from chicken. For vegan proteins, I like pea protein is good. Watermelon seed protein, interestingly, is a really good option. You can also get egg proteins. Some people have dairy sensitivity, but if not, whey proteins are good. So find something that's pretty pure protein and just doesn't have a lot of like flavors and sugars and things like that. Keep it simple. You can add flavor with all the other things you put in the smoothie.
So rather than those smoothie powders where they might say that they've got protein and then they've got all these other flavors and things in them, it is just that real protein powders type from the health shop sort of thing that you added in, and then add your berries and your honey and your other things in to make that sweetness.
Yeah, and you could put like some vanilla yogurt in it or things like that to give it a flavor.
Yeah, and if women Google tiger's milk, there's loads of little recipes on the internet as well for making those protein rich fantastic combo smoothies when you are lactating, that have got all those extra things in there that are so helpful in that period as well. So sometimes it's the women want to do the right thing, but they're kind of feeling a little bit lost on, whoa, there's so many options, what do I do, sort of thing, isn't it?
Yeah, well, and what I can give you too is we have a cookbook of soups, and I think it also includes our gluten-free sourdough bread recipe. So I'll give you that women can download. It's for immune building specifically, but it really is for everything, because as we just mentioned, just like you're body building this baby, you're actually immune building their immune system, and you need really your immune system postpartum for a couple reasons. One, your immune system while you're breastfeeding is sort of hybrid your baby's immune system, because you're giving them the antibodies for everything you're exposed to. But postpartum, because you're so fatigued, because you're often nutrient deficient, because you're so stressed, is a time when women get, chronic sinus infections and easily get sick. And, this is a good time to really build up your own immune system for yourself.
Absolutely. And now for those that have registered for this particular webinar, they will receive an automated message within 24 hours of the webinar, where we're going to be including some of that information. But of course, sometimes people are watching this weeks and months down the track. So do you want to just explain the way that they would get hold of a copy of that information?
Yes, let me see if I can find it really quickly.
It's so funny that you talk about broths, and when I was very busy full-time caseloading as a midwife, around 50% of my clients would be Asian or Indian, and those Chinese mothers. The grandmothers, I'm talking about the mother of the mother.
Yes, absolutely.
Like they will, it would never cease to impress me how their whole focus practically was on putting together these amazing broths for these new mothers. And those of us who do not have Chinese heritage, we should be jealous.
That's right. Well, exactly. I mean,
I think the way that the mums are not expected to really raise a finger for that first sort of 100 days or so, particularly the first 40 days, and it just can make such a big difference to recovery and mood. I think that unfortunately, and I'm being very stereotypical when I say this, but Caucasian women, in modern westernized countries, really tend to get probably the least amount of hands on deck helping them out. And often their mother is still working, their mother-in-law is still working, their girlfriends are working. There's just not a lot of people around. And boy, what a difference that Well, and you saw that difference when you hired yourself a doula and a night nurse.
Exactly. I mean,
Oh,
you
God.
know, that's the challenge, right? Is having the support system
Yeah.
to bring, you know, not even cook all this food. Like, the good thing is, I think what we do have in modern Western societies where we don't have the support of our families, which would be better in many cases, sometimes not, you know, sometimes that comes
Yes,
with strings
sometimes it
attached,
can be a
right?
bit much.
But we often do have access to like meal delivery services. We have kind of communities of friends in that same, going through that same stage of life, who will be willing to bring that support, spouses, other family members who can cook on the weekends and bring some food. I think one of the things is to just really ask for what you need, to even know what you need is step one.
Yeah.
And then planning in that third trimester, or even when, if you're in postpartum and you're like, well, I missed it, now what do I do? I'm like sitting on the floor, tired and exhausted, you know, ask for that support specifically. And people are very willing to help, but a lot of times they just don't know what to do. So they might just bring you a pizza or something, which is great, but it's not all the nourishment you actually need to build that baby. If you said, you know, hey, could someone bring me a giant thing of protein powder and some almond milk and a, you know, some frozen berries, then that's really helpful. It's like super simple. They know what to do. It's, you know, you could even kind of create that as a baby shower gift sort of thing, where people are thinking ahead about planning, you know, someone can bring meals, but we also have like meal delivery services and things like that, that the spouse can be very supportive with, you know, going to pick up things, knowing in advance what the resources are in your area. There may be some restaurants that have homemade soups in them. You know, you may have smoothie bars around. So there's a lot of support, even if you don't have that person making the key broth for you, although that's invaluable if you can get it. And you can go, so online, we have that cookbook available. It's a free download.
Explain your, do give through your website details and the links, etc. Talk about that.
Yeah. So if you go, so our main website is Integrative Women's Health Institute.com, and then / immunity soup cookbook. You will get that free cookbook. You can download it, share it with all of your friends and family, and say, you know what, and share it with all your patients if you're working with people with postpartum, ideally in the third, you know, early as possible. And they can start prepping. A lot of my clients really do prep the soups in advance. They freeze them in batches. And then you have something ready, especially for those first 2, 3, 4 weeks, when really you ideally don't want to do much of anything. You're just dealing with,
and
you know, sleeping and eating.
Yeah, and doing that meal prep in that last trimester, filling your freezer full of it all. It's, I always say there is not one meal that you will regret having made in advance.
No.
All of them. You kind of want to get yourself into that place where you do not need to cook for a month.
Yeah. And so if, you know, so if you're a practitioner working with pregnant or postpartum women, or anyone who's trying to optimize their immune health these days, this is available to you. Feel free to share it with all of your patients and clients, you know, and print it out, whatever.
Repeat the address again.
It's Integrative Women's Health Institute.com / immunity soup cookbook.
Fantastic.
And yeah, and if you just go to the main website, we also have a blog with a lot of other resources around everything from breastfeeding to pelvic pain, if you just want to explore some other free resources.
Cool. Okay, that's awesome. Now, another topic that we wanted to squeeze in there before we wind up today, but what about sleep? Because that's obviously becomes such a big deal with women in that postpartum. They need sleep, but of course they I always say, you want to get onto the baby's cycle. So, you sleep when your baby sleeps, you eat when your baby eats, you you shower, you wash when the baby washes. You just got to get into their cycle rather than them trying to go into your cycle. Is so much easier. But sleep obviously is an issue. So what about nutrition to help with that?
Yeah, so it's the same thing. Our sleep is kind of triggered by certain hormones. So having enough fat is key to sleep, having protein before bed. So if you're finding that when you actually do get to sleep, you're waking up a couple hours later. Now, sometimes that's just habit from either having to go to the bathroom or having to breastfeed or whatever. But if you actually have the little bit of space to feed where the baby's starting to sleep 5 or 6 hours and you're still waking up, consider what you might be eating or drinking right before bed. Because remember, we talked about that stress response system. It's strained when you have sugar or alcohol right before bed. And so
protein before bed.
Yeah. So protein and healthy fat, protein and a little healthy fat before bed. So something as simple as like a little bit of celery and peanut butter, or,
avocado,
turkey. Yeah. Avocado rolled with turkey and lettuce or something like that. A little small sandwich. Keep it really simple. It doesn't have to be anything complicated, but when you have that protein and healthy fat right before bed, it'll help kind of settle your nervous system so you don't have the blood sugar irregularity that can trigger an early wake up.
And when you say before bed, kind of how long before bed are you talking about?
It can be any time in the last 1 to 2 hours before bed. You can do it closer to bed if you tend to be really hungry in the night. But the big key to avoid, and this is a little hard because again, you're exhausted, you're under all this stress, is everyone's finally sleeping for 5 minutes. I think I'll have a small glass of wine or a little ice cream or something like that. Having sugar or alcohol right before bed is where the problem lies. So having a little of that, postpartum isn't necessarily an issue, but the timing is key. Much better to do it in the afternoon, maybe even right before or with lunch, so that you're still using that energy, not trying to sleep.
Right. Okay. Yeah, makes sense. Okay. And just a comment in there about alcohol, because women often will, ask, well, can I drink alcohol when I'm breastfeeding? And basically, a really simple way to just throw this in here, but a sort of simple way to gauge it is that is that alcohol usually gets into your system and it's pretty strong in that system for that next sort of 45 minutes to a couple of hours. So we can say that there's no safe level of drinking alcohol when you're breastfeeding, but you can sort of be logical with it as well. So if you've just fed your baby and the baby is going to be asleep for the next 3 hours reliably, and you have half a glass of wine, well, in 3 hours from now, that really is pretty much kind of left your system. And so, yeah, that's the way to do it if you're going to have
I think, of course, as you said, of course.
But I just kind of add that in there. I always just say to women, if you think about the situation of being breathalyzed when you're driving, right? That breathalyzation test is really the equivalent of what's going on through your bloodstream. So it's no different, right? So if you think, well, if I have half a glass of wine now, and in 3 hours from now, I am breastfeeding my child, what would be your alcohol level if you blew on it? Well, nothing, probably, or close to it. So there's because sometimes women, and I'm not trying to promote drinking alcohol when you're breastfeeding, but sometimes you get situations where women, they haven't drank their whole pregnancy, and now they're not drinking the whole time that they're breastfeeding. And I've seen women contemplate giving up breastfeeding because, you know, they haven't had a drink for 12 months and they're actually over it.
No, I agree. I think
Yeah, we don't
clearly
want women doing
to not breastfeed.
hurry just because they don't know that they can have a drink. It's just about timing it.
Yeah. So, and sugar's the same way, timing
Right.
it, you know,
That
less
timing
is
it.
more for both of those, of course. You know, if you feel better, it's healthier in general for women not to drink alcohol for themselves, not just for their babies.
Yeah.
But it's also, you have to consider the cultural piece, you know, just moderation of life. So I completely agree with you. I think as long as you're really paying attention to the timing, and, you know, a lot of times this stuff is much easier when the baby's closer to 6, 7, 8, 9 months old, because you're on a more predictable schedule. They're eating some food, you know, it's very different when we're talking about
you're not the only food supply for
nutrition supplier. Yeah.
Mm-hmm.
So that first 2 to 6 weeks postpartum is a really different nutrition requirement than 6 to 9 months postpartum, or 9 to 12 months postpartum. So it is important to keep that in mind when we say postpartum. That's sort of vague. You need all this really intense support for the first 2 to 12 weeks, depending on how your birth went and how healthy you were, and, you know, what's going on with your baby and everything else. And then, you know, everyone starts to get into a rhythm and you have different kinds of support. But for some people, actually, that second phase may be worse because they're immediately back to work, and then they're, you know, a lot of output, and they're trying to exercise. And, you know, if you're exercising and building a baby and working full time and have other children, you know, the amount of nourishment, not just food, but sleep and, you know, just emotional support you need is really as much. You have to think of yourself as like an Olympic athlete. You have to recover in that way. You have to get support in that way. You have to nourish yourself in that way, because you're literally, you know, putting a lot of strain on your stress buffering system when you're under stress in all of those different ways.
Absolutely. Look, thank you so much, Jessica. It's been really great going over a lot of those details today, and just reminding ourselves of reminding our women of, you know, just that importance of having some awareness of what they're going to be needing in that postpartum period. And your resource sounds really interesting. Is there and useful? Is there anything else that you would like to just conclude with?
No, I think that's really the key, is to keep in mind that while we've normalized giving birth and, you know, running back to work and having no support and not having that person making you the specialized broth, there are reasons why culturally those things have prevailed for thousands of years. Is because they're so valuable to that recovery. And, you know, we're not machines. We have to really think about what our bodies need to recover in the same way we would from any other surgery or any other major athletic event. So
absolutely. Well said. Well, thank you so much for your time today. It has been lovely to have you here. And thank you to those who were attending live today. And we look forward to, and those who will be watching this later on. And I just want to wish everybody a wonderful rest of their week. And thank you, Jessica. Thank you very much.
Thank you so much. Thank you.
Okay. Bye, everybody.